There we go. Do we have it? Did
Okay.
it work?
Can you hear?
I can. Can you hear me
I
okay?
heard you got really excited, and then I was like, oh, it's completely froze. So I was like,
I feel like every time I do a live, I never know what's going to happen. So it's so fun though that way. It like completely breaks the ice, and you're like, it is what
just
it
the
is.
working into just trying to figure everything out.
Yes, yes. So, oh my gosh. All right. So we'll get right to it because I know you also have little ones that you have to go pick up at some point today. So thanks so much for joining me. This is so fantastic and such a piece of important area for midlife women. So it's so awesome what you do, and thank you so much. And so I'm gonna um let you introduce yourself and tell us all about you and what you do, and we can go into questions after that.
Awesome. Thank you so much. So, Dr. Amanda Skowron Romano. I'm a licensed clinical psychologist in the DC metro area. And for me, I've always had that specialty area, stress and anxiety management. After when I graduated, I've worked in integrative medical centers. So I'm a big fan of mind body medicine. My dissertation was on postpartum depression. So women's health has been my world through all of my training and post. And so I always have always worked with women on their journeys through fertility and perinatal postpartum periods. And I really love when I get the opportunity to work with people longer term. And so all of a sudden I realized that all these women I was working with, they kind of like allowed me into their lives at different times. And everyone was like, kept popping back up. And it was always kind of this
Yeah,
like perimenopause, menopause, like, and I was like, oh my goodness, like I've always lived in this women's health. And then as we all very well know, you start to look at research and I'm like, this is mind blowing. The ease that I found research on women when they were in that area of child rearing and being able to get pregnant, it was so robust. And then this area of like perimenopause, menopause was just mind blowing how like little there was.
yeah,
So then I was just on that mission to seek it out,
yep,
right? So then over the last year and a half particular, I've just been doing as much continuing education, this partnering with people, just trying to understand this other significant time in women's lives and bringing a voice to it. And I mean, stress and how we're handling stress as we transition into that part of our lives that every single one of us will experience at some
yep.
point is so instrumental that it just kind of really aligned with my interest areas already of women's health, stress management. And that's kind of how I started to meet practitioners like yourself and just started to do a lot of collaboration of
Yeah.
being very loud about a topic that has been too quiet for too long.
Yeah,
So,
absolutely. That is so awesome. And you just recently went independent and on your own, right?
yes, thank you for
Yes.
that nice segue. It shows how much I'm not used to talking about
Yep.
that. So, yes, just starting this month, I went solely into my full private practice called Peace of Mindfulness. And so, just that idea of helping everyone to realize that one of the things I'm really on a mission about is that therapy is about health and wellness. I think a lot of people think about therapy when you need to go to talk to a therapist about that,
Right.
right? Like
There's a
this like
stigma
negative,
there, right? It's a
yeah,
stigma.
and
Yeah.
negative connotation. And so when I worked at the integrative centers and somebody would, be having IBS or having, this, even a skin rash or like just like all these different things, like, and they would be like, well, why would I talk to a therapist? And they'd be like, well, your stress level, right? Like
Yeah.
if you're a human being walking this world, like you have stress, you have things you need to deal with. So piece of mindfulness, my mission is to definitely continue working with women, seeing individual clients, but also to get out this information about how everybody can manage their stress better and just pay attention to their mental health.
Yeah, absolutely. And so, and you do telehealth and right. And so kind of tell me how your practice works. I know a lot of times we do that at the end, but sometimes it's nice during the beginning, how your practice works, who you can see.
Oh, I love it. Yeah, so even before the pandemic, I always did at least 2 days of telehealth work because a lot of my clients were new moms or people with medical conditions. So when someone has a migraine or is going through chemo or just has a brand new baby, when you live in DC, you drive 45 minutes for a 45-minute session.
Right.
So I've always done a lot of telehealth. And then once the pandemic happened, I've now full telehealth. And it was good timing in the sense of there's something called PsyPacks for psychologists. So I can actually see clients via telehealth in 42 states.
That's
And the
awesome.
reason that's so valid is you work with someone, you have that rapport, you have that trust, you work together for, a significant amount of time, and then they move. And they had to end that because of this arbitrary, like we were still seeing each other telehealth. They were
Right.
like, you're still the same background, you're the same person, and yet I can't see you. So that was a game changer for us. So the fact that I can continue to work with people or give people access to this information
Yep.
that don't live in the DC
Right.
area.
Right. And that need it. I mean, it's not like it's kind of like menopause practitioners too, right? There's not a plethora of psychologists and especially dealing with women going through midlife and perimenopause and menopause transition in
Yeah.
and of itself. So it's so nice to have that telehealth, just, like a lot of us that are just menopause practitioners do, because you can just expand your services to a lot bigger variety of women, which is really neat
Yeah,
too.
absolutely.
And so most your patients then find you on your website and can book an appointment there, and we can link your website to once the live is done. We can put that in the comments. So
Yeah, so we will make sure the one of the easiest ways is just go to the website, which is peaceofmindfulnessllc.com, and you'll see a contact form and you can just schedule. I think one of the messages I would love to get out, whether someone sees me or not, is therapy is about fit. So a lot of people don't know that we're trained in different ways. So that idea of that specialty area that I have, it breaks my heart a little bit when someone's like, oh, therapy just didn't work for me. And then I hear that it just wasn't the right fit.
yeah.
So for me, I was trained in a lot of mindfulness and acceptance and commitment therapy and interpersonal. So if you were to come to see me, we don't live in a bubble. So we'd be definitely processing life events. But I do believe that there's a lot of skills that I've learned that can give you. So I like that combination of processing as well as skill building.
Hmm.
So if someone didn't have that, right, and they went to someone and it was just really just processing and there wasn't a lot of skill building, or people will go and it's just skills, or so I always offer a free 15 minutes phone consultation with everybody
Yes,
because I want to hear what you're looking for. I want to be honest about what I can offer, what my specialty areas are. And
I love
thankfully, I
that.
have a ton of wonderful colleagues that if I'm not the best fit, you will leave with a list of referrals
That's awesome.
just so the journey
Yep.
continues. But thank you for saying that because I think that's so important. I would encourage anybody. Sometimes somebody will call me and be like, kind of sheepishly, like, I've been having these consultations with like 3 people, and I'm like, fantastic, right? Like,
Yeah.
I'm not hurting my feelings, like, find, because your healthcare, even when I worked with functional medicine doctors or acupuncturists or you name it, when you trust that provider, that's a huge part of your care, is
Yeah,
just that
it's
relationship and that
right.
trust.
That's right.
So,
If you don't jive with someone, it's going to be really hard to open up, to trust
yeah,
them, and to just work with them as a team. You're a partner, That's I like to with my patients, or I'm partnered
yeah,
with you. I'm helping you through
yes.
this, right? Same thing. And so it's really important that you have, you feel a connection.
Mhm.
And so what are some of the things that you're seeing women in midlife struggle or through the perimenopause and menopause transition, either risk factors or just things that you're seeing that they're struggling with?
Yeah. First and foremost, which isn't a, like identified risk factor, but I just have to say out loud, is just the validation that this change is happening,
Yes.
right? So like
Yep.
so many times somebody will come and so one of the risk factors is a history of anxiety or
Yep.
depression. And so someone will come and say like, I've worked with you before, like I'm doing all of these skills and like and for me just to pause them and just say, I believe you, right? Like I believe that you're still meditating and you're still working out. And did you know that there's some different hormonal things that you could do
Hmm.
or just these different changes? And I'll be like to say, now that's out of my wheelhouse, but I have some amazing
Yep.
providers like yourself, and to give them that list. But it's amazing how many people just see it as like almost a flaw or they're doing something wrong. And like I said, coming back to that mind body medicine, like there's true physical changes happening.
Yes.
So as much as I can absolutely be an integrative part of that treatment, there's a lot of other areas. So let's not swim upstream, right? If
Yeah.
we can try, different hormones, different medication supplements, or let's get you into the hands of someone who can help you to understand that. So off the bat, I would just love to say, like, that's just powerful in itself, that validation of like these symptoms are real, brain fog is real.
It's real.
It's not in your head. You're
No.
not going crazy, like all of that. So I think
Hmm.
that's so powerful. And I think that does speak to like some of the main risk factors we know: history of anxiety and depression. If you're coming in, just think about your hormones in general. So when you talk with a woman, even when they go through their menstrual cycle, or if they choose to have children, we all walk through that path differently because our bodies
Yes.
respond differently. So when I work with someone who says, I've always been somebody who's had more, some of those extreme changes around my cycle, or when I,
Hmm.
so that's going to be a factor, right? Just how our bodies,
100%.
how
Yep.
our bodies function. Um, and then of course, stress and anxiety management is my wheelhouse. So that if you think about someone's stress level as they go into the
Yeah.
transition of perimenopause, right? So if you think about that, I'm just looking at this plant that I have here. Like if you're taking care of that plant and you're watering it every day, but then all of a sudden like something starts to happen to it, like somehow a bug got in and got on, it's gonna fare better if it had the right soil and it had all of these things in place before. Versus a lot of times we're not taking care of ourselves, and
Right.
we're not doing any
Right.
stress management, and we're not eating right, we're not exercising, and so this transition's hard enough, let alone when we're starting at a deficit. So I think that that's another one of the risk factors, is just what is someone's stress level. And so that's an area I could talk a lot about if you're interested in, about just what do I mean by stress levels and what could be
Yeah,
different.
absolutely. I absolutely. And we just had someone say that women need to be seen and heard, and I think that's exactly right, and that's exactly what you are validating. What I think all of us validate is it's so important just to say yes, what you're feeling is real,
Mhm.
100%. It is not in your head, and just I mean, sometimes you can just see them just like thanks.
Absolutely.
It's just this like sigh of like, okay, because everyone's telling me I'm acting crazy and I feel that way. I feel out of control. I feel spiraled. The littlest things set me off.
Mhm.
And, you add in children and you add in full-time jobs or part-time jobs and parents and other stressors. And then, you just feel like when you were such a rock before and now all of a sudden your coping skills are not, they weren't working like they were before.
Yeah.
And so, but yeah, so I'd love to hear about the stress component and how you help women handle that.
You just brought up a really interesting thing. So, one of the things we know from research of why mindfulness is also very effective is we know that whenever we can name the emotion, it already brings down the physical response to it, right?
Mhm.
So, you know that moment when someone looks at you and they're like, "You're mad," and you're like, "I'm not mad," right?
Yeah.
And versus that time when someone says, "I don't think you're mad. I actually think you're really hurt right now," and they
Yes.
feel valid, and it's just like that's the ease you're talking about. So, when someone comes to me and I say, I believe you, and I think you're feeling really helpless right now because you've went to three different doctors who are saying
Yeah.
your levels look fine. I don't understand. Or I actually had one of my clients say that their gynecologist said, "You're on birth control, so you'll just glide through this."
Yep. I
And I
hear
was
it all
like,
the time.
no one's gliding through
No. Nope.
anything.
And it works for some women, yes, but not for all of them.
Right, right.
Yeah.
So one of the things is like even like one of the things I love offering people is even just these little nuggets that you can hold on to. So of course, I'm a psychologist. I like to identify emotions, but there's a lot of value in putting a word to that
Yeah.
experience and how your body eases when it's accurate.
Okay.
So, but in terms of stress, when I'm talking with someone, really talk a lot about the nervous system, and again, that's why I love working with different practitioners in that mind body, because I would say probably 98 to 99% of people who come to see me, when I say, "Do you know about fight or flight?" They're like, "Yes." And then I'll be like, "Have you ever heard of like rest and digest?" And they're like, "No, what's
Yeah.
that?"
What's
And I'm,
rest? What's
yes. And I'm
rest?
like, just so if anyone doesn't know, we have fight, flight, or freeze, which is our sympathetic nervous system. And we have rest and digest, which is our parasympathetic nervous
Mhm.
system. And one of the most effective, and if you think about that rest and digest, how many people have upset stomachs all the time,
Yes.
IBS, can't sleep? So
Yes.
when someone comes to me, without saying too much, I already know our nervous systems are dysregulated.
Hmm.
And so, and even think about that. So if you're going through these natural hormonal changes and your nervous system is already in this very active place, that's not a good fit,
Right.
right? So
Right.
someone comes and even understanding that. So people like rest and digest, tell me more. How do I get to,
How do I get
experience
there?
that? Yeah, I would be there. And our breathing. just
Hmm.
really small breathing practices. So even for those who are kind enough to be listening today, if you remember nothing else of what I say today, remember that the exhale is the calming part of the breath.
Yes.
And the reason that's so important is because when someone's stressed out, what's the first thing we tell them? Take a
Yep.
breath. And what do most
Yep.
people do?
Take it.
They
Yep.
inhale. And then they
Hmm.
activate their system.
Yep.
And then they're like, breathing doesn't work. The stress management stuff doesn't
Right.
work. Like,
Because you took the deep breath in and then you held it.
and so many of us are just walking around just holding our breath. So I know
Yeah.
it might seem like, but it's these little things. So I think people get intimidated about coming to therapy because they know I'm going to talk about lifestyle
Yep.
changes. And I think they think
It's
of sweeping.
scary.
Yeah, it's very scary. And they think of sweeping lifestyle changes. Like they think I'm going to recommend 45 minutes of meditation and 45 minutes of exercise. And what happens is when you come to talk to me, I'm going to hear where you're at. I'm going to hear what
Yeah.
you tried. I'm going to believe that you're the expert of your life. And when you tell me that mindfulness meditation isn't the best fit for you right now, I will believe you.
Yeah.
And I will help you to understand that there's different ways to be mindful throughout our day. And there's different things we can do with our breath. And there's different things that, so I think just starting there and helping someone to, we say that a lot, that there's a mind body connection. But when you have someone in your office, let's all just do this with me if you don't mind,
Hmm.
to do a relieving sigh. So a relieving sigh, if you're sitting up really nice and tall, and you lower your gaze towards the ground, and you make a nice exhale out through the mouth with just a slight sound. And a lot of people will say like, wow, even that feels
Yeah.
a little bit better, right? Just
Yeah.
like that little sigh.
Hmm.
It's not magic. We're releasing carbon dioxide.
Right.
We've walked around the whole day, chest breathing, not using our diaphragm, taking in a
Hmm.
ton of oxygen, not releasing the carbon dioxide. And so you could imagine, like, this isn't magic. Like, this is just understanding your body and understanding when we know our nervous system and take care of it. So between every single client I have, I do a relieving sigh because my hope is that when I get in session with you, you know that you have my full attention. And it's a game changer. It's a game changer as a parent, as
Yep.
a psychologist, as a human being, to like give that presence. And that's just to give that to yourself,
Hmm.
right? So that's what I mean by like, I think people are intimidated by all the lifestyle changes. And what I'm hoping they take away from today, don't underestimate small, consistent changes.
Right.
If the all the takeaway for me today is I'm going to do a relieving sigh at least once every single day for the next week, we've got a little progress. Your nervous system's already
Yes.
a little bit better.
Those are those small goals I like to talk about, right? So I think as women, we set these goals and we almost set them as unattainable goals, and then we're upset when we fail, but it was a goal that was almost unachievable to begin with, right? And so
Yes.
I think that so we do that. We're hard on ourselves as it is. No one else needs to be hard on us because we're harder. And then we set these unrealistic expectations of us to do all of these things all of the time.
Yes.
And so, yet the same in that little amount, of time I get with patients, I talk to them about like these are the goals that we're going to achieve, and we're going to make them achievable. So that way you feel good when you do it. Whether it is starting one small hormone, we're going to start this, and we're just going to do this, or we're going to journal our cycles and how we feel, and you're going to let me know how you do. I mean, just the littlest things. And it makes such a big difference because all of this is so overwhelming. And it can be
Yes.
so overwhelming.
Yeah, I think it's so just so you know too, whenever we write or talk about something, we process it in a different part of our brains.
Hmm.
So a lot of times somebody will leave a therapy session or talking with someone, or even like you said, just writing those symptoms down.
Yeah.
That is a beautiful step, right? Like,
Yeah.
and so I think a lot, you watch all of this and you see all of these different groceries you have to buy, or like these workouts and these just, and so when you start with someone and say, for me at least, I start with curiosity always and say, I'm actually not going to change anything at first. I literally just need you to write down where you're at, what's been going on, like help me because that's the thing about perimenopause, menopause as well, is that age differences, right? So
Yeah.
like there's
Yeah.
a big gap there. I make zero assumption where someone's at in this whole
That's
process as
right.
well.
That's right. It's hard to know, right? It's hard to know
Yes.
where,
Yeah.
yep. You
And
can't
that
assume.
collaboration. So when
Hmm.
someone's working with someone like yourself and signs a release, so I can communicate and you can let me know they've been on this hormone for this long. This is where we're at. This is so I love that team
So
approach as
helpful.
well. Let truthfully talking, having a healthcare team that looks at your mind and body. And I think
Hmm.
that's so powerful just to have these relationships and this team around you that believes you and wants to figure out what's the right path for you. Because the path is definitely going to look different for every
Yep,
woman.
it is. It is just like perimenopause and menopause experience is different, right?
Yeah.
So, we say a lot about, just don't compare yourself, just like your patch dose. Don't compare your patch dose for one person to the next because you absorb completely different and your receptors are completely different. And so I see, that trend sometimes when we start to say, well, you're a little too young for that. How are you experiencing that? And so, you know, it, we have to be very mindful of those types of things because we don't know.
Yeah.
We don't know if these women, these things, these changes can happen before you know it. And
Yeah.
it's your mid to late 30s, or
Yeah.
if they are going through it early and there's something going on that may be one of their only predictors too, is that they're having some mood changes.
Yes. Or that I hear this a lot too, where I'm not having hot flashes.
Yes,
I'm
I
so
hear it all the
connected to
time.
hot flashes. And I was like,
Yes.
I always laugh. Everybody who works with me knows that like I really empower people to be their biggest advocates. So when you go to a doctor and they say something like, oh, well, you're not having a hot flash, I'm like, time out, we need another second opinion.
Yep. That's your red flag number one.
So I think that that's really a stand. So I appreciate you just because again, what do I hear a lot? I hear I'm having heart palpitations. My
Yes.
interest there is anxiety
Yes.
management, right? So someone is having heart palpitations and they can't sleep. I must be having panic. This is all
Yes.
panic, right? And so those symptoms are there, but when I share with them, like, hold on, like, where are we at? Tell me some of the other things that are going on for you. And then it's like, or like even just like my eyes are dry, I have joint pain, I have like, and they're having this cluster of symptoms, and I'm like, I cannot ignore this.
You're
Like,
right.
I need you to like just make sure you're having this conversation. And one of my favorite people that I follow about this said it really well. Like, my job, I don't think is to end, like, I'm not trying to help convince anybody of their
Hmm.
decisions. All I'm asking is for you to know all of your options and then you decide,
That's right.
right? Because it's not that like sometimes that might not be the best fit for you.
That's right.
And again, I'm not sure, but I just want you to know it's out there and then you get to have a choice about
Yes.
it.
That informed decision is so powerful. I was speaking with someone earlier this week, and we were talking about hormone therapy and, DCIS and things like that. And they had said to me, if you're just going to tell me, if there's any chance of increasing my risk of cancer or a recurrence, I mean, if I just have to live with it and I have to live with it. And I remember sitting back and just saying, no, not at all. And actually, I want you to have all of the information, the pros, the cons, the risks, the benefits, and then it is your decision to make. And I will support that decision, whether it's to try something, not to try something, but you have to have all of the information. So that way you are okay with whatever decision you
Yeah.
decide. And
Yeah.
then know that those decisions are not always forever if you decide that you change your mind on something. And so I think sometimes, when women are scared or they don't have all the information and then they're putting the brakes on, that we just need to, that's when we have to step back and just say, nope, I just want to provide you with all of the tools in my toolbox that I have. And then if I don't have the right tools, I'm going to find someone that can,
Yeah.
that has the different tools that I don't
Yeah.
have, and give you all of the information so that way you can make this informed decision of whatever it is that you need, so that way you can be healthy and happy and have longevity and all the things, and be successful in
Yeah.
midlife and
Yeah.
beyond. So,
And that's so important for mental health.
mhm.
So I know that I'm on and I'm happy to talk through specific skill sets or specific
Yes,
therapies that I do,
yes,
and that's all wonderful.
please.
But at the
Yeah.
end of the day, what we know about therapy and or even just any of those is again just what you just described, right? Just feeling seen, knowing those choices, like this is so important. So I was like, as you're talking about this, and like that's such a big part of for your mental health as well, is the empowerment around all of it.
Yeah.
So that's just and like interpersonal aspects of perimenopause, menopause, right? So you're talking
Yes.
about irritability in that moment of like when you have a reaction and that doesn't feel like you, right? So that's one of the things that in terms of like that mindfulness work that can be helpful. If you were asking, one of the biggest benefits I have seen personally and the research has shown us is that decrease of reactivity
Yep.
and just that increase of just being very intentional about our responses. So I'm going to be honest, I'm
I'm
talking to
not
you. I don't have
very
a magic wand.
good about that sometimes.
Like I can't just
Sometimes I
eradicate
react before
irritability.
I.
Well, and I think you and I talked. So I have a 5-year-old and an eight year
Yep.
old, and we have moments when you're trying to get out the door and do a whole bunch of stuff, you know.
Hmm.
And so, and that's the thing too, like you had said before about just being human. And I think that's one of the approaches I will take when someone works with me too. Like I'm human. Like we all, you
Yeah.
know, irritability level. So it's not going to take away all of your irritability by any means, but to feel like I could potentially help you to have some skills about how to handle that irritability, you just feel more empowered,
You
right? So it's not
do.
going to work 100% of the time. It's not going to get rid of it,
That's
but
right.
it does going to make you feel a little bit better to say like, oh, the relieving sigh, like even today, right? Like that's something when my son wasn't getting in the car and we were
Yes.
you better
The
jump
late.
up,
We're always
please.
rushing in the car, right?
So like, yeah, and
And
I
he
love
wants to
it
do
too.
everything himself. And you're just like, I know. I want
Yes.
you to just not right this second.
Yes, and I love it because like I just this idea of like even my kids at this age are even just like, okay, let's just take a breath.
Yep. Because
Yeah.
mommy needs one.
All together now.
It's funny because I do tell all of my kids, I have adult children all the way down to our youngest at 8, and he really needs the breath. He's a little Irish Italian, and I just look at him like, I'm so sorry. You just. But even for them, when I'm like, if you just take this big deep breath and let it out, and I look at him and then I'll give him a hug and I'll say, does that feel better than me yelling at you or you yelling? And he's like, yeah. I'm like, I know. It's
Yeah.
great, isn't it? Not, you're right. And not that that works all the time,
Yes. Yeah.
but
But the reason I bring that up is because I do get that question of like, well, these are hormone changes. Is this physical? Like, what could possibly a psychologist do for me?
mhm,
And that's just a small example, right? So irritability goes up. We can help you to know how to manage that. Sleep. We do know that we're going to keep that context in mind of these
mhm,
physical changes going on. But there's a lot. I'm trained in cognitive behavioral therapy for insomnia. So there's some of those
that's
techniques
great.
that are still really helpful. So no, just that's why I am such a believer in having multiple providers
Yes.
because I
It's the
cannot
support
just do.
system,
Yeah, so they're completely right. They can't just come to me. We can only do so much,
right?
but we put all of this together and it can make significant changes in quality of life. And that's
Yeah.
one of the things I've always been really big on coming from an acceptance and commitment therapy approach is we see reduction of symptoms as like a nice like afterthought. We're like our main intention is helping someone to live a life that has meaning and purpose and value and doing things that are outside their comfort zone. So when someone says, I was really nervous to call a psychologist and they got out of their comfort zone, I'm like, it's a huge step. That's
This is
the first
huge.
step,
It
you know?
is. It
So
is. And we get that even just as clinicians for coming from menopause. I was afraid to call, or my husband made the appointment, or my partner made the appointment because they were just like, they don't want to take the time. They feel guilty to take the time for the visit or whatever that is out of their life to take care of themselves because we've been taught that we don't come first.
yeah,
And how many times, I'm sure you have said it, how many times do you say, if you cannot take care of others, if you are not okay,
yeah,
and
yeah.
it's difficult.
And that's the thing I was just talking with someone who is actually going through perimenopause, having some irritability, just struggling to like brain fog to get things done. And they went to visit their adult child and they were like Johnny on the spot getting all of these things done. And I was like, this just goes to show like when I talk really about self-care with someone, I don't mean a bubble bath. Bubble baths are
Right.
fine. But like what I mean by self-care is that truthfully, as cliche as it sounds like that relationship with yourself. The
Yes.
reason you got that done for your child is the way you think about
Yeah.
that being, that person, and so that moment of, I guarantee if your child came to you and said, I'm just really irritable lately and I'm having a ton of brain fog and I can't sleep, and you'd probably say, do you want to talk to someone? Like, let's
Right.
offer that to ourselves. Like that's what I mean by self.
Yes, you are
Having that type of
100%.
relationship with
Yep.
yourself.
And sometimes I think we have to step back and say, what would you tell your, younger you, or your daughter or your son, or your spouse, or your best friend? What would you say to them?
Yeah.
Because that's probably the advice that you should take too, right?
It's a really great gauge. And then that's like a classic cognitive behavioral therapy is like, what would you tell a close friend? What would you tell? Because it just gives you that little bit of shift of perspective. And it's so
Yeah.
helpful.
Yeah, it is. And we talk about breaking the stigma of menopause and perimenopause, but I think there's such a stigma of the mental health care that's behind it as well, and breaking that stigma. Because sometimes I think that, you know, well, it is. It's not that I think that it is such a big part of this transition. There is such a large percentage of women who either get worsening anxiety and depression or new onset anxiety and depression
Correct. Yeah.
through this stage and through this transition. I think suicide rates increase as well during this transition. And so it's not a small
No.
concern. It's,
Yeah.
it really is a concern. It really needs to have light shed on the mental health changes that can occur.
Yes. And yes, that silence around it all, right? So, and it is hard. It's even hard when that's been our identity. So, a lot,
Hmm.
many women who come to me will say, kind of, we talked about before, like managing all of these different things, careers, kids, and like now that brain fog, and they're like, I'm forgetting my kids.
Right.
Like, what?
Right.
Like,
I'm going to leave my job. I'm going to leave my spouse.
God,
I'm,
oh, two
going to
big
leave my
things, right?
children.
Yes,
Hmm.
career changes and relationships.
Yes.
Huge components, right? So I do couples therapy as well.
Oh, great.
And that's a part of it, right? Is just helping to understand some of those
Yeah. These
changes that
partners
they've
don't
seen.
always understand what's going on. They're like, what in the heck is happening to my partner? Where'd they go?
Yes.
You know?
Uh, so I think that that's just again to talk about it. And I think I'd shared with you where I know that I think you had done one too, the M factor screening.
Yes. Yes. Tell us about some of the things you have coming
Yes.
up.
So I was just saying, I think I'm so excited about that. So on February 7th, which is Friday at 6 o'clock in Ashburn, Virginia, because I don't know where everyone's at. But we are going to do a panel discussion, and it's going to be myself, a colleague,
Yeah.
similar to yourself, who does
Christine
hormone,
Hartpress.
Christine,
Yes.
yes, Kim Dixon, who's a physical therapist, as well as Dan Simons, who owns Founding
Awesome.
Farmers. So there's going to be some good food and some good conversation. We're going to watch this documentary together and then answer some of these questions. So I will say, I
That's
think
awesome.
at the end of today, there might be a wait list. So if you're at all interested, please check it out
Yeah.
sooner versus later. But even that, like just having the conversations, right? And whenever they had asked me, like, hey, do you want to do this? I'm like, 100%. I felt really so excited that they were including mental health provider on the panel. Like that was
It
just,
is so, so, so
yeah.
important. And I was so excited. And you have one other really exciting thing that happened today. Tell
I
us all what happened
So
today. It's so
I
awesome.
I actually have my first book published. So I talk about just these moments in life, So I had this idea for a children's book when I was on maternity leave for my daughter. My daughter is now 8 years old. And so, when you just have something percolating in
Yep.
your breast, and I'm on here talking about how I'm going to try to empower women and have meaningful lives. And it's like, you know what? Like, this is a value, a goal I've had for a while. And this year, starting Piece of Mindfulness, like focusing on that, I was like, I think it's time to get this into the world. So the
That's
book is
awesome.
called The Worry Bug, and it's a different take. So I come again from more of a mindfulness, acceptance of emotion. So many times when someone's worried, do you ever notice like how, like when you tell yourself, don't be worried, how does that work? We tend
Yeah.
to worry a lot more then, right? So the more
Yes.
we tell ourselves to not worry, the more worry we get. But we're very intimidated to just pause and sit with those emotions. Many of us just want this to go away. We want the worry to go away. We want the
Yeah.
anxiety to go away. So we do a lot of avoidance techniques.
Hmm.
So when we tell worry just to go away, so this is for children. And I'm going to be honest, Julia's the name of my daughter, so she's in it. Charlie, our dog, is in it,
I
and he
love
gets
it.
sick, and she's worried about him. And so what it helps someone to understand is mom comes in and teaches that if we do diaphragmatic breathing, if we do some breathing and we sit with those emotions, our emotions have this tendency, especially anxiety, that it will peak. And then what happens is if we can breathe and we can sit with that discomfort and we can learn how to sit with that discomfort, it will naturally come down. What happens for a lot of people, they've never been told that. So they come and they're experiencing the peak of the anxiety and they don't mean to, but with their thoughts, they keep re-triggering that
Hmm.
anxiety. Make this go away. What is wrong with me? This, my heart is pounding. There's butterflies in my belly. All kind of cute ways to talk about this in the book. But
Yeah.
it's really a way to teach kids at a young age that how to sit with an emotion, how to teach them breathing, and has a little cute mantra that they could repeat to themselves. So instead of making that worry bug go away, they say, worry bug, everything's okay. And
Oh, I love it.
sometimes, you know, through mindfulness meditation, my teachers would always tell us, if we're breathing, there's more right with us than wrong. And so if you're a human being breathing in this world, you have something to offer. And I just loved that. And so
That's so
I've been sitting
true.
on this forever and just the universe and
That's
the
so
timing. I got
awesome.
live literally just a few hours ago, and I'm
That is awesome. And where can people find that? It sounds
on
I would read it for
Amazon.
myself.
Yes,
So on
thank you
Amazon, and
so much.
I'll link it on my story or whatever as well. So
So
that's
if you go to
awesome.
Amazon and you can put in the worry bug or
You
Amanda
can find
Scott
it there.
Romano, and it will come up. So thank you. I'm so excited.
Oh,
Thank you for
that's so
asking.
fantastic. And we can find you at Peaceful Mind. Tell me again
Yes.
so I don't mess it up.
So Peace of Mindfulness,
Piece of mindfulness.
LLC.com is my website, and it has my contact information, how to schedule with me, anything you need. And don't hesitate. I literally just giving information and getting this out there is really important. So if I can
Yes.
help, I'm happy to help.
Yes, and I'll link that. But she's also, if anybody is on my newsletters, she's part of my Midlife network also. So they can always find you through there too if they click on that, and then all of your information is right there. So thank you.
Awesome.
I know you have to get running and go pick up your little
Yes.
one. This was so amazing. Just continuing to build this midlife network, I like to call it, of women helping women and standing up for women and getting them through this transition that we just have been told, to suck it up, and it wasn't real, and it is. And I just thank you for all that you do. It's so, so important.
Thank you. It's very real. Please come talk to me about it. And thank you so much for this opportunity, including mental health providers in these discussions.
Absolutely. We appreciate the collaboration. You have a great weekend and congratulations on everything.
Thank you so much.
All right. Bye, everyone. Thanks for
Bye.
joining.